Today I want to present to you some more information on the Progensa PCA3 molecular urine assay. The information is based on an abstract that has been recently presented at the Global Congress of Prostate Cancer, and it basically reports on a clinical study which confirms the utility of this test for predicting repeat biopsy outcome. And the data obtained by this study has been accepted by the FDA to introduce the PCA3 assay for management of prostate cancer patients. Here is the abstract. It's available on this link, and it was, as I mentioned, it was presented at the Global Congress on Prostate Cancer. What it basically shows is summarized in the following. It was a multi-center study, and 466 men were participating. The question was whether the PCA3 assay is helpful for predicting repeat biopsy outcome. It showed that at a PCA3 score cutoff of 25, 50% of repeat biopsies could have been avoided, while only 8 high-grade cancers would have been missed, which would have been subjected to observation in the next 6 to 12 months. As I mentioned, the multi-center study was a prospective study. It included 466 men over 50 years with more than one negative biopsy before inclusion into the study, and these patients were recommended for repeat biopsy. Overall, the positive repeat biopsy rate was 21.9%. That is 105 out of 466 men had a positive biopsy. The study showed that lower PCA3 scores were associated with a decreased likelihood of a positive repeat biopsy. Men with a PCA3 score below 25 were 4.6 times more likely to have a negative repeat biopsy than men with a PCA3 score over 25. And if this threshold of 25 was chosen, the negative predictive value was 90%, thus optimally reducing the probability that men with a negative PCA3 score still have prostate cancer on the biopsy. In other words, this cutoff value allowed to say that a value below 25 was indicative of a negative biopsy. When this PCA3 score threshold of 25 was chosen, 50% of repeat biopsies could have been avoided, while only 2% high-grade cancers would have been missed. And what it basically says is that adding PCA3 to the regular parameters that are taken to manage prostate cancer patients makes sense. And specifically, it allows a more accurate prediction of repeat biopsy outcome. So it was concluded that this multi-center US study confirmed the clinical utility of the PCA3 assay for predicting repeat biopsy outcome. At a PCA3 score of 25, the negative predictive value was 90%, and, that's important, 50% of repeat biopsies could have been avoided, while 2% of high-grade cancers would have been missed. And here's the summary again. Combined with PSA and other clinical information, PCA3 can more accurately predict repeat biopsy outcome and provide clinicians and patients with independent, clinically useful information to make more informed biopsy decisions. And this is again is shown here. This is from the abstract. Again, 466 patients were included. 102 had a positive biopsy. 364 had a negative biopsy. And when you then analyze those that had a PCA3 score of below 25, you see that 5% in this group were below 25 and 45% in this group. And what it basically shows, in cases of these patients with a PCA3 score of below 25, one would have considered avoiding repeat biopsies. This is a summary. This is decision without and with PCA3, whereby in the standard decision model, variables like age, serum PSA, the result of the digital rectal examination, family history, and history of previous negative biopsies play a role. And when PCA3 was added to this decision making, there was a significant improvement of the negative predictive value, the specificity, and the positive predictive value in this diagnostic process. Based on this study, the US FDA has in February 2012 approved the PCA3 assay for use in conjunction with other patient information to aid in the decision for repeat biopsy in men who had one or more previous negative prostate biopsies. To make a long story short, a PCA3 score below 25 is associated with a decreased likelihood of a positive biopsy. If you may wish to obtain more information on the availability of the assay, you may wish to contact Noviogenics in Nijmegen, telephone number, email, website. Many thanks for your interest and attention.